Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 7th of July. The essence of the COVID update is that we are seeing a somewhat increased number of COVID positive patients in hospital, so that whereas this time last week we had 10, today we are showing 16. So that's people who are within 14 days of their first diagnosis of COVID. We've one patient in critical care, we've one patient in Clifton, and 14 on our general medical beds in the hospital. And I'm sorry to report that we've had 2 deaths to list in the last 7 days. So that takes the total number for the pandemic for us up to 770. So my condolences to the families of the 2 people involved. And this is on a background of a picture where we're seeing the numbers for the Fylde Coast continue to increase, actually, very much in the under 60 age group. So as I've said many times before, the impact of vaccination has been absolutely massive, and we see that in the sense that the infection rate is rising rapidly in a non-immunised population and really hardly at all in the immunised population. So it's so important for people to get their vaccines, and anyone over the age of 18 can go online and book a vaccine straight away. There's also, of course, the immunisation bus in Blackpool, and if you go on the Blackpool local government website, you'll be able to find out where that is, and actually you can pitch up to the bus and get a vaccination straight away, so it's incredibly convenient. Just to give you the numbers, the Blackpool prevalence is showing at 372 per 100,000, whereas last week it was 304. For Fylde, it's gone up to 323. That's quite a big jump. It was 212 last week, and for Wyre it's 335, and again it was 236 last week. More stats around immunisation rates. People who've completed both doses of vaccination, 64% for Blackpool, so room for improvement there, 73% for Fylde, 75% for Wyre. The more we keep going with the vaccination programme, the better we will all be. Made a point about testing before. Just draw this distinction between asymptomatic testing, no symptoms at all, but just checking. You can get LAMP tests from lateral flow tests, I beg your pardon, from any pharmacist, and test yourself for COVID. But if you are symptomatic, that's the time to self-isolate and to arrange a PCR test. And the point about the PCR test is it will screen for the variants. So we know really it's the Delta variant that is most predominant at the moment, but it's the PCR test which you book through 119 or the NHS website, which will clarify that point. And if you are at all symptomatic, please do not go to work. Please get tested before you do anything else. Our emergency department has been extraordinarily busy, as we know have most of the walk-in centres across the Fylde Coast. On Monday we had over 100 people in the department, 100 patients in the department at one time, and that's pretty much a record for the department. It's of course a concern to us, because when the department gets so busy, it's much harder to maintain our infection prevention and control situation, but also of course we start to see long waits for patients, so it's a worry to all of us. So if you are worried about an urgent problem that is not an emergency, then please will you go and either ring 111 or dial, or look at the 111 website, which is actually www.111.nhs.uk, and follow their advice through that programme. So I think really that's the essence of my COVID update. We're all watching the national news carefully, aren't we, to see how restrictions change. But from a hospital perspective, this is really still a big issue to us, and we're going to maintain our infection prevention control policies and procedures rigorously for the foreseeable future. So just at the end, I want to say something about another matter that's in the media at the moment, and this involves the voluntary interview by police of a member of staff in relation to some alleged offences that have taken place in our hospital over the past years, and that obviously is having an impact on our staff and on our patients and on their families. I really just want to reassure everybody that we are completely engaging with police and other regulatory authorities around this. We're giving them all the information that they require. We're confident that our own services now are safe for everybody, so please access them as you would as normal, and we will keep you updated as we can about investigations as they develop. Thank you.